Will democracy survive the next couple of years?
Access to Democracy is made possible by donations from the following organizations. Thomson Reuters, a global company with expertise and insight to unravel complex situations in the areas of law, tax, compliance, government, and media. Their worldwide network of journalists and editors keep customers up to speed on relevant global events. Thomson Reuters, The Answer Company. Crutchfield Dermatology, a full-service treatment center and Medi-Spa in Eagan. Their goal is to help you look good and feel great with beautiful skin. With service built around courtesy, dignity, and respect, Mayo-trained Dr. Charles Crutchfield personally treats each patient and is acknowledged as one of the nation's best physicians. Truestone Financial, with locations in Minnesota and Wisconsin, has proudly served its members since 1939. Truestone engages, educates, and supports its members to ensure they have the tools to empower their financial well-being. Truestone Financial, your neighborhood credit union. Learn more at truestone.org. Edina Eye Physicians and Surgeons, a division of Twin Cities Eye Consultants, has proudly served the Twin Cities for more than 55 years now, in 7 convenient locations. Using the most advanced technology combined with human touch, Edina Eye offers comprehensive services and dedicated specialists committed to excellence, with innovative procedures and expertise for the most advanced eye care.
Welcome. Access to Democracy returns. Alan Miller with you as usual. We have a first-time guest, and I'm really pleased to welcome him, Dr. Kamran Karimi, who is with Fairview Health, and he's a vascular surgeon, and he has a convoluted path from Pakistan to Minneapolis. So I'm going to ask him, after I say, welcome, doctor, explain to us how you followed that path that brings you here.
Thank you for having me, guys. Nice to have met you in person and here over the interview today. So I finished my med schooling in Pakistan in the year 1999, and then I came to the US to work and train in general surgery, and I was in Morgantown, West Virginia. I worked there for 6 years. Then I went to Rochester, Mayo Clinic, and did my training in vascular surgery. And then for 7 years after that, I worked in Iowa, in Waterloo. And then from there, when we decided that we're going to move out of Iowa, we were looking for a Midwestern town, and Minneapolis just seemed like a very good option. And I've been very happy with that decision.
And from what I read of the reviews of your work and your patients, they're very happy with that decision as well.
Yes.
And I think you sort of glossed over a lot of your background, because not only from the university in Pakistan, but I believe you spent some time at an NYU Lutheran Medical Center in Brooklyn.
No, I wasn't in Brooklyn, no.
No, I understood that you were intern of the year for 3 years there.
Well, I was intern of the year in Morgantown, West Virginia.
Oh, Morgantown.
Yeah.
My apologies.
That's okay.
And what about Stony Brook Hospital on Long Island?
Nope, I was never there.
No. It's interesting. Your curriculum vitae online indicates those places.
Oh, I don't know why it does that. I was, loyal mountaineer, as they call them in West Virginia. So I was there for 6 years.
Is there another Kamran Karimi running around?
I suppose there is. Maybe I should meet him or her.
Well, you did your residency in West Virginia, and you actually got a fellowship to the Mayo Clinic.
Yes.
Which is one of the most highly sought after fellowships in medicine. In fact, the Mayo was just again selected this week for the 4th straight year as the #1 medical facility in the country. And So you chose to go into vascular surgery. Why don't you tell us a little bit about what that involves? I know it's diseases of blood vessels, but really, it's a lot more than that.
Yes, it does involve the blood vessels, but what we recognize is that there are blood vessels all over the body. So every part of the body has a system where the arterial system would bring clean, fresh blood, and the cells in the body would use up all that blood, with use up the oxygen, then dump the toxic wastes that they produce, and that has to go back to the heart and then recycled into the organs that clean them. So it's a very complicated circuitry that's working 24/7. And I got interested in those diseases. And interestingly, when I started my general surgical residency, I was destined, so to speak, to become a plastic surgeon. I was the apple of the eye of the plastic surgery department during my residency. And sometime in the latter years, I just realized that the actual calling was vascular surgery, because I was working with one of the very old school surgeons at the VA hospital, and he was asking me about what I wanted to become. And I said I wanted to be a plastic surgeon, and he was somewhat dismayed because he himself was a vascular surgeon. And he asked me, think of all the difficult cases you've done. What has been the common theme? I said, it's when you run into bleeding and you don't have control over it, when you lose control of the case. And then he said, you know what, then you should become a vascular surgeon. And the rest is history.
In other words, plastic surgeon is just another pretty face.
No,
And
I will never say that, because there is cosmetic surgery, and then there is reconstructive plastic surgery like burns, hand surgery, reconstruction after mastectomy, for example, or any tumor that is removed from the body. So cosmetic may be just a part of it, as they show in Hollywood soap operas, etc. But in reality, reconstructive surgery is a very, very important field, in my opinion.
uh, score one for the medical profession there, where I try to put down ego surgery. But really, we're talking about circulatory blockages of arms and legs. You were talking about the blood having to go back to the heart and then repump through the body.
Correct.
That's one of the things that you certainly deal with, right?
Yes.
You deal with veins and varicose veins.
Correct.
And explain what a varicose vein is.
So majority of the blood when you are standing is stored in the lower part of your body, and the veins are also called capacitance vessels. So at any given time, two-thirds of the blood volume, circulating blood volume, is located inside the veins, and they're all below the level of our heart. And these veins, when you're standing upright or sitting, have to take the blood back from the feet up back towards your heart. So there is this pull of gravity, which would otherwise not let blood go in the upward direction, but through various forces and mechanical, um, let's just say a mechanical system, which involves presence of one-way valves, make sure that blood is going in the upward direction only. Now, a varicose vein is any visible vein in the legs which is greater than 3 millimeters, and typically they appear under the skin. They look like these ropey, big veins, especially in the calves and ankle area. And they occur because the valves, which are trying to keep the blood flowing in the upward direction only, tend to break down, and blood again pools down in your legs and pressurizes and fills up these veins. Veins are
Is it
capacitance vessels, so they can distend to many times their size if you fill them enough with blood.
is it fair to say that that's more prevalent in older individuals than in younger?
Actually, it's prevalent in all age groups, but the classic ones are middle aged females who have had children before, or have a genetic history, a family history, or have jobs which require standing?
I know, speaking for myself, and of course, these legs are 87 years old, but they look like a roadmap of places you would never want to visit. And uh, we can talk professionally about that at another time. But another thing you deal with, I know, is angioplasty. What is that?
So, angio is typically any blood is considered an angioplasty. So, when we say angioplasty, typically we are referring to treating arteries which have a blockage, and you go through a blocked segment of an artery, and then you go in and inflate a balloon which expands the artery, and then you take the balloon out and that leaves the channel that is open. So we do it typically for any part of the body where there's poor blood circulation because of a blockage.
And what about aortic aneurysms?
So the aorta is the main trunk artery that comes out of our heart and goes and gives branches to every other part of the body. An aortic aneurysm is an abnormal fixed dilatation or enlargement of that vessel. And think of it like a balloon. If you keep filling a balloon with water or air, eventually it will burst. So here we have an artery which has blood coming at normal blood pressure, and that keeps expanding till one day it would burst. And when it bursts, it's a catastrophic surgical emergency which is potentially fatal. So aneurysms are fixed. Majority of the time we like to fix the aneurysm before they get to a point where they would burst, and that's based on size. In my practice, it's I really just base it on size and gender when I decide how to fix them and when to fix them.
So certainly vascular surgery is certainly important to life itself. And I know when I researched a little bit of your background, other than the fact that we came up with a bunch of hospitals that you don't know anything about, uh, I saw that you were board certified uh, and very highly thought of by your peers, which to me is a very important measure of how proficient you are. Now, let's talk about your board certifications. Where are you certified?
So I'm board certified in general surgery, and because to become a vascular surgeon, and this was when I was training, you had to go through 5 years of general surgical training, and then you would do a fellowship or advanced training. So I got board certified in general surgery, then I actually practiced general surgery, then I trained in vascular surgery, and then I board certified in vascular surgery. And then recently I just recertified, and this is in no way an admission of my age and graying hair. I recertified in general surgery and vascular surgery.
And you speak several languages. I know that you speak Hindi and you speak Punjabi, as well as obviously very well spoken in English. Uh, does that come into play at all in your practice?
It does, and it is, the rare occasion that you feel that you get referred from um, a patient who speaks a language that obviously helps. And you always think in the language that you were brought up with, and the language I grew up speaking is Urdu or Pakistani, and one always thinks in that language and then translates. At least that's how I think I do it. So yeah, Hindi is the language of our neighboring country, India. I speak that as well because we used to watch their movies, their cinema growing up.
Bollywood,
And I dabble with a little bit of French.
a little bit of French.
Yeah.
Très bon. Uh, Now, your family is here in the Twin Cities,
Correct.
and we are going through really a terrible, terrible time in this country. And I'm not even talking about the pandemic yet. I'm talking about partisanship and prejudice against people who don't look necessarily like I look. Uh, have you or your family experienced any of that prejudice?
No, I have not. And I have to say, I'm very lucky to be in the state of Minnesota that I have not felt like this at, well, maybe once at the state fair, but that's just about it. But you have to go with how the majority of your day goes. So 99.9% of the time, I have not seen it, I have not felt it, and I have wonderful work environment, wonderful colleagues, patients. So I'm very privileged, I'm very lucky where I am in in the where I'm living. I should say that I have not had that problem.
And
But this is not to say that the problem does not exist.
no, the problem does exist, and the problem is just a horrible problem. And it's a problem that has plagued us, but it's gotten much worse in the last 5 years, in my estimation, as we have this white nationalist movement that seems to think that the country has to go back to 1785 rather than go ahead to 2085. And my prediction is that in 50 years, the complexion of this country, and I mean in terms of individuals, will be very different. And I think it's a good thing. I think it's immigrants who have really made their mark on this country and made this country what it is. And I understand that we're going through difficult times, but I think people don't appreciate that. I think social media has something to do with that also. I don't know what your thoughts are in that regard.
So far as the we obviously have to uphold the first constitutional right, which is free speech. But when the line between free speech gets pushed to where it becomes hate speech, is where I take difference to it. I agree with the fact that myself being an immigrant, my father being an immigrant when he came to the country the first time, and we made it based on hard work and meritocracy, which again I should give full credit to the US meritocracy system, that it has allowed individuals to be able to do that. This well and truly is the land of opportunity and democracy. Look around the world, for example. It is still far better than what I see in other countries.
In almost any place. And the
On
fact,
in a lot of places. I mean, I will step out of bound and say, look at China, for example. Suppression of free speech, um, persecution of minorities, or no free journalism. Turkey, for example, Russia, for example. We are still way, way better off.
oh yeah, there is no doubt in my mind. And the fact of the matter is that a lot of the people who are guilty of some of the prejudices here forget the fact that we, other than Native Americans, are all immigrants to
We
this
are all
country.
immigrants.
And we all came here, or our ancestors came here, to escape prejudice generally, or to better ourselves and to better our families. And the fact that we have treated the Native Americans so terribly over the years and broken so many treaties, people just seem to be able to disregard that and be self-centered, and it really is troublesome to me. But let's get back to you and not politicize this interview. How has the pandemic affected your practice?
So in the beginning of the pandemic, so to speak, I'm talking about spring of 2020, our practice relies on patients coming in to see us for a potential vascular surgical problem. We would see them, we would decide surgical treatment versus medical treatment. So, in the first few months onward, spring of 2020, we could not do any of our surgical procedures that we had on our elective schedule. So, we were only dealing with emergencies. And so that affected your, because as surgeons, I would tell you, like to be busy and in the thick of things. A mind as fast as ours, so to speak, it should not be allowed to run idle. So that was very difficult for a lot of us. And I speak for myself, my colleagues, my nursing staff. It was very difficult in those terms. But this was obviously nowhere close to the plight of physicians in pulmonary medicine or emergency department or in infectious diseases or the nursing staff. I mean, they were overwhelmed with the surge of COVID-19, and obviously all hats off to them how they just braved and weathered the storm.
I saw an article, and I was talking with Sharon, my wife, about it, that a lot of medical staffs are not fully vaccinated. Seems that the doctors are fully vaccinated, but I can't imagine that a staff, particularly one working in a hospital where they deal with COVID patients, wouldn't be fully vaccinated. And I don't know if that's because they can't mandate it or why. This fear of the vaccination is to me so absurd, because the fact that they created these vaccines in record time and that they have been proven so successful would seem to me that everybody would want to line up to get them. And we're seeing now in the South uh, the fourth surge of the anti-vaxxers.
So, in regards to that, you know, again, speaking that as far as individual freedom is concerned, US tops the list in my candid opinion. But on the flip side, people who are in healthcare provision have that freedom, but they also have this huge responsibility. And to say that not take the vaccine because there are multiple conspiracy theories that you are going to become infertile or you are going to develop problems from the vaccine itself, or the vaccine doesn't work, or it has not been tested enough. All of these multiple theories of anti-vaxxers have been sufficiently debunked, yet some people don't want to take it. I beg everybody who is in healthcare and is not taking the vaccine to understand that they have a responsibility, and it is do it for your patients. Don't do, even if you're not doing it for yourself, do it for your patients, because you may not get sick, but if you are what we call an asymptomatic carrier, you could carry the bug and give it to somebody else who cannot handle the infection and will die because of that. So stop making this a political statement, because it's not.
And I couldn't say it better, actually. Now, I know that you spend a tremendous amount of time with your practice, but you also have a family. Uh, you have children, and if so, ages and what do they do?
So I have four children. They're 16, 14, 10, and 9.
Well,
They are
I don't have to ask what they do then.
well, besides driving their mother insane, they are all in school. They're actually very good children. They're all in school. They all have a musical instrument. They all have a sport, and they all have a language other than English. So that keeps them all busy enough.
And what about you, hobbies? What do you do when you're not in surgery or in the office? And I don't know how much time you have, because I know you spend so much time in the office, but you've got
Oh,
to have a
I
life
make time.
outside the office.
If you came and look at our practice, you would realize that I am the least of the workaholics. My other partners are true workaholics. I am not so much, because I like spending time with the family. In the winter, we ski. In the summers, we go on bike rides, go to the pool, go to the cinema. And as a like my personal time, 45 minutes every day, or at least 4 times a week, I make it a point that I go to the gym and lift weights.
I wish you hadn't have said that, because my wife has been absolutely driving me crazy that I don't get enough exercise. And I'm now doing Tai Chi for 1 hour a week. And she says, yeah, but what about the other 6 days?
Well, I will have to back her up on this, because, in the winter, when I came from Pakistan, and over there, the options of weather are hot and very hot, and I would get depressed in the winters with the long working hours. One of my chief residents, he would tell me that you are one workout away from a good mood, or a one run, or one short trip to the gym away from a much better mood.
And I guess that really holds true.
It really does, and it's been proven that regular mindful exercise releases the same kind of joy chemical, so to speak, that we feel happy about.
I know back in my younger days when I was jogging, uh, after jogging for a couple of miles, the endorphins kick in,
Exactly.
and you really do feel as though you're on a high of some sort. And I get that now when I walk my dog.
And
That's
being with
about
the
the
dog
size of it.
is another endorphin releaser, so it is definitely worth it. It's that 1 minute in the morning when you're trying to get out of bed, or that 1 minute when you're trying to decide should you go to the gym or not. It is always worth it, in my opinion.
Well, it's really been a pleasure speaking to you, and I hope we have the opportunity again sometime.
Yep.
And we've been speaking with Dr. Kamran Karimi, and we've been speaking to him in English, although he speaks so many other languages that it really Hindi and Punjabi and little French and whatever else you might think. And he is a vascular surgeon with the Fairview Health, located in Minneapolis, and very highly respected. I really appreciate your taking the time out. I hope you didn't leave anybody on the table just to come in for this interview.
Well, thank you for your wisdom, and thank you for the hard work you do, and thank you for putting the freedom of this country front and center here.
And it's so important to all of us.
Thank you.
Thank you again.
Have a good day, sir.